being that you came in with us as casual. What will you take away?
Just how fast people can come together and work and just help each other out, really.
Okay. Then thanks for that. In the middle of dealing with changing criteria, we were asked by the Department of Health to immunize our children in the school system. And that's not really a big deal because we do school immunizations all the time. But we never did it like we did it this fall. Kim, are you there?
Yes, I'm here.
Kim Buckle is a licensed practical nurse who works with us in CVS. Kim, can you tell us a little bit about the school immunization process?
Sure. Although community health nurses are very experienced with the school immunizations, being a licensed practical nurse, this was my first experience. LPNs in the community is a new role, however, immunizations are now a very big part of that scope. The team consisted of new and seasoned community health nurses, as well as the support staff. And due to the high volume of students from K to 12, there were many days that we went from one school in the morning to another school in the afternoon. When we'd get there, we'd just look for the good old Eastern Health box, open it up, and everybody dig right in.
Support. So that was Terry who made your life easier.
It was excellent, actually. The boxes were prepared very well. We'd just get to the school, we'd get everything ready. The clerical support really helped out with that process. And the community health nurses would begin to immunize. It actually worked really well. Each community health nurse was immunizing a student approximately 3 minutes in between each one. So it was quite the process. And it was very organized, and it was a great example of teamwork. Everyone knew their role and worked together extremely well.
And what did it mean to you personally for being part of this team?
Being part of this team, it was actually really exciting. It was a very positive experience that I'll take with me, and I gained a lot of experience from the seasoned community health nurses that were with us.
Thanks, Kim.
You're welcome.
Supporting Kim, we had Lori and a lot of other nurses and staff who were employees, and we had a lot of people who actually stepped out of their normal roles, like we've already heard of today, to take on tasks that needed to be done. Janet, are you there? Janet Fisher?
Yes, I am.
Okay, Janet is a primary health care, works with primary health care in Bonavista. And Natalie Morgan, are you there?
Yes.
Natalie is a clinical nurse coordinator with us in Bay Roberts. So, Janet, can you tell me what your normal job is?
Well, normally I focus on chronic disease prevention and management and working with the healthcare team here in Bonavista. And I focus a lot on community development, working with other sectors and other partners in the community on a variety of initiatives and working groups.
So what did you find yourself doing in this fall?
This past fall, I was called upon from my experience as a community health nurse, I guess, in the past, to act as one of the 4 team leaders in the Peninsula's region. I was reporting to our Director of Integrated Community Services here, Mona Romaine Elliott.
Right.
And we were responsible as a team. We worked together to plan and coordinate mass immunization in our end of the region. So daily, on a daily basis, I guess, Mona would communicate with us and provide updates from the province and the region about how the criteria was changing, the vaccine availability, and our immunization plans. And then we would work together to plan and coordinate delivery of the vaccine in the community.
And Natalie, what's your normal job?
I'm a coordinator. I provide leadership clinical support to community health nurses in both the Yeoman Community Care Nursing and Public Health Program.
Okay, so what did you do this fall?
Clinical lead at the mass immunization sites.
Okay.
Yeah, which was overseeing the clinic, like both for clinical practice and any troubleshooting that may have been there at various stations in the mass immunization site.
Okay, so can you tell us a little bit about the team that you had working?
Well, I worked from outside in. If we were lucky enough on that day, you probably would have met a security guard.
Okay.
Because emotions were high, and especially at the first when criteria groups were limited. And then inside we had some managers from various programs that sort of took the lead on the numbering system.
Yes.
And crowd control. And then we had clerical support for data entry registration. And then you would move to screening, which would be nurses. And these nurses came from various programs, both community, health promotion, mental health, community supports programs. then we would have consent, and then you go to immunization team.
And it was the same in all parts of the region. Absolutely, right? Every clinic that you had was set up that same way.
Yes, very similar, yes.
Yeah.
And then we would have on-site support like managers, nurse managers, and other managers from other programs, and an off-site support such as the CDC, MOH.
Okay.
Mm.
So, Janet, what will you take away from the experience in Bonavista Vista?
I think it certainly showed, as other people have already said here today, that when you work together as a team, you can accomplish pretty much anything. I think that was the big message. And I think for me, too, because of stepping outside your normal role from a day-to-day basis, it's important to be flexible and adaptable. And I think that helps to pull us through.
Natalie, you got anything else to add to that?
Yeah, I think I'm very proud of our team. The commitment to their clients was quite evident every day. They would go beyond, above and beyond. Like I seen a nurse picking at a client because she knew the client was hearing impaired, so she used sign language. Getting a wheelchair for the elderly, things like that. Like despite the challenges, they were there to meet the goal to protect the public.
Absolutely.
Yeah, and committed to their own team members too as well.
Yeah. So you all grew as a team.
Yes.
Absolutely. Janet and Natalie so thank you very much. They weren't the only ones who took on new roles during H1N1. In St. John's and throughout the entire region, staff from everywhere, whether it was budgeting, learning and development, quality, any department that we called up on or I called up on, they stepped outside of their normal jobs. Shelley, are you there? Shelley Byrne?
I am.
Okay. Shelley works with us in budgeting here in St. John's. Shelley, what role did you play during pandemic?
My first taste of the pandemic was a phone call on Sunday evening when my manager said, dress comfortably tomorrow morning. I have no idea where you'll be.
And where were you, Shelley, when you came in on Monday morning at about 6:30 or 7?
I was on a ferry to Bell Island.
You were sent to Bell Island?
I was.
Okay.
Sharon Lear, my boss, came in and said, somebody needs to go to Bell Island, Shelley.
Yes. No question about who was going.
And I was sent there to secure a site, and we spent the next day there with the clinic,
okay.
And then one of my colleagues took over after that. The next day, I was at the Reed Center, where I spent most of my time. So I usually showed up at 7 in the morning and started screening the people for the criteria, giving out numbers, telling them.
So you became a screener and you work in budgeting. How did that work?
Yes. Yeah, I usually had a public health nurse. We had a team. There was Josephine St. Croix and myself, and that's who they put out every day.
Every day.
And we screened people, asked them questions about how they met the criteria, and then if they did meet the criteria, or perhaps if they didn't, Josephine usually took over then and did a really good job explaining to them, to keep listening. We gave them the information brochures, gave them the number to call, told them to come back if they had questions. They could come back every day if they needed to. And we also explained to them that the flu assessment clinic was available and where it was located and if they felt any symptoms to go. So we didn't make people leave without having some level of comfort. So we actually had some people who commented and congratulated us for that, who thought it was really nice of us to let them know in advance. And I was shocked one day when a lady said that to me. She said, I'm glad you're here. And I said, well, it's nice that somebody thinks that because not a lot of people thought that some days. And she said, no, but you're saving me about an hour and a half because I would go in there, sit down, I would get to the lineup, and they'd turn me away.
Yes.
Though you're turning me away now, I'm okay with that.
Okay.
So I thought that was very nice of her.
So what will you take away from this? This was very different work for you. You were touching the public, every interaction that you had.
Absolutely. On a daily basis, I deal with managers and directors. So I don't deal with, clients or patients in any way. And this was a really different role for me. I heard a lot of stories from people, and most people were very understanding that they couldn't meet the criteria. Some people weren't, but you have to live with that. Most people were very understanding, and it was dealing with people on a daily basis like that. And also, I met a lot of people that I would normally never have met. nurses and LPNs and managers who were retired who I hadn't seen in a while, and so we got to connect on that sort of level as well. So that's what I'll take.